Wait. So, obviously needs to Okay, let's go.
lane to keep right to merge onto Highway 401 West.
Huh? That's password. Got to go college. For the border. Huh? We have a passport. Yes. I thought you said passport. Oh.
For children. For excuse. Violent pressure. They retreat video. Simple loving gesture that occurred to tears. At that moment, I don't believe it was without prospect. Right. It's right, but it's a good way to protect him.
39 kilometers. Continue straight.
This and the innocence of the youngest. Even dishes. Eric saw his mother's demands as a challenge to rise up to, but we still love them. And he saw them differently. To him, they were almost normal. And with each passing day, felt higher. There was no way out. Like other sons, Benita expected the best, just good grades, but the best he could possibly. Every subject, every exam, every semester, he had to push past his own limits. There was no such thing as enough. And to Vanita, it wasn't cruelty, it was preparation. She believed high school was what a child's future and wanted her son to have the greatest one possible. Now, Abe wasn't a failing student. He was quiet, yes, often kept to himself, but polite. If someone said hello, he'd smile, and his grades were not bad at all. Some would even say impressive. Apparently, that was often told their kids relaxed or played games. Abe was told to sit down and study. Don't waste time. Say, think of your future. Did what he was told to study, good, and go. His own vision for his life. I know. And when he tried to explain that to her and tried to speak up about the pressure, the stress, mental state, he didn't take it well. Scolded him. Well, when he started to scold him, it's older brother Jerry. That conversation, instead of being as a bridge, someone who would help her understand what he was going through, Jerry allegedly dismissed their concerns, told him to listen to mom, not hard. Person he thought would understand. Murder study experience record. Basically, Pressure. Yes. That you said except for a few mostly occupied by elderly residents. The investigation expanded into the forest nearby. That is where they found her. Very was officers. Later, first, victim and clear signs. The cause was a broken bone, slightly from strain. The forensic doctor estimated that there was no personal, nothing to say. No, you're just based on those descriptions. The police then reached out to them. It turned out they had already filed this.
Your next stop is Costco gas. We're about 21 kilometers. Great.
And the last fighting footage of her station. There were reports dates spell follow. Justice was served.
A message. You have a message.
Despite the disturbing nature of Lien's death, some updates ever made to the public. So, first, what was their connection? Father worked for a foreign pharmaceutical company, so that I'm insurance. Others. Others were on the bank. The older sister woman. Okay. Yes, was raised personally peace and gentle. He did just the outside. Let's pick up. Guy has a wild and bird. Right. Driver. And later to the aesthetic page, represent stand out. Also, wanted to hard on I'm prepared and your scholars. In big tails. After she graduated, something changed. My sister classmates instead she made something after starting. As I had when her past. So it's like cat breaks lives on fire 19. Ladies, I'm reading this like yes, definitely great. Great. Here, I great. Yeah. Video. HIV is the human immunodeficiency virus. You have HIV, you have an infection that damages your immune system. That causes AIDS. AIDS stands for acquired immunodeficiency syndrome. Dr. Queen Elizabeth Way toward East Hampton, please. Sided heart failure caused by pulmonary disorders is called pulmonality. Pulmonary conditions that contribute to right-sided heart failure are chronic obstructive pulmonary disease, or COPD, cystic fibrosis, and acute respiratory distress syndrome, or ARDS. As the overworked right ventricle labors to get the blood into the normally low-pressure pulmonary arterial system, its walls hypertrophy and pump ineffectively. Blood remain in the right ventricle, raising pressure inside the right side of the heart and pulmonary arteries, forcing the right ventricle to work harder to overcome the resistance. The heart muscle hypertrophies and pumps ineffectively, resulting in the insufficient delivery of nutrients and oxygen to the heart and other vital tissues. Blood accumulating in the right ventricle and atrium congests the venous circulation, including the vena cavae, jugular veins. Circulation in the liver's tissues leads to hepatomegaly. Reduced cardiac output deprives the kidneys of blood, impairing filtration and their ability to remove excess sodium and water. Nocturia, or excessive urination at night, often reflects the renal impairment secondary to right-sided heart failure. Retained sodium and water increase the blood volume pumped by the overloaded heart, raising vascular pressure and increasing resistance against which the heart must pump. In response to venous congestion, fluid collects in the skin and soft tissues, causing a condition called peripheral edema, and in the abdomen, causing a condition known as ascites. Treatment for heart failure, such as it's commonly prescribed for heart failure. Diuretics, which reduce fluid volume and venous return by inhibiting sodium and water reabsorption along the kidney's renal tubular system. ACE inhibitors, which block hormones in the renin-angiotensin-aldosterone system, dilating vessels, lowering blood volume and venous return, decreasing the heart's work, and ventricular digoxin and increases the force of myocardial contractility by raising intracellular sodium and calcium concentrations. And beta blockers, which compete with norepinephrine molecules for binding sites on cardiomyocytes, preventing norepinephrine's effects, resulting in reduced speed and strength of the contractions, which can support more efficient circulation through the body.
every place. Wait. All the or to control and regulate and communicate with other parts of the body, from your brain, your torso, even in your sexual organs. So we're going to go to the whiteboard and go through each of those organs and what they do. Then we'll enlist Terry's help to see where those organs are located three-dimensionally in the body. And finally, we'll recap everything at the end. So let's jump to the whiteboard to get started. So here we have an outline of the human. We're going to start in the brain. The pituitary gland is this tiny gland that hangs off the anterior side of the brain, right up there. It's a small gland, but a mighty. Basically, the pituitary is partly off and control the other glands of the endocrine system. Sort of the leader or controller gland. Apparently, what we need to do to help straight glands to do to help over what to do. Here. Well, right now, there's two time limits. It's more going to stimulate your bones to grow here. You can help you. The process X first of all. There's that.
Kilometers from the Queen Elizabeth Way toward East Hamilton.
Giving a friend regulate your growth. Thank you. Your man to regulate your sleep. That's good. Regulate the virus. Your thought makes your voice sound good. Basically, reaction.
Great. From the Queen Elizabeth Way toward East Hamilton.
It's fully circle. It's my favorite. Your bones calcium being that calcium can't make it. And if you're nervous,
22 kilometers. Great.
you think of the parathyroid glands, think of the skeletal system. But also think of calcium. It's it's what do you get? Biggest way. If you never had a find it at all, your body would be more susceptible to different diseases and pathogens. Like the abdomen, you have the pancreas. The pancreas releases it's take the system. And if you take insulin, then you their pleasure. Pancreas will regulate in your blood. The energy needs to increase your age. Pancreas releases insulin as well as the heat. also push here, increase. Being
Stay in the left 3 lanes.
add beats next to and renal. That's the they look like little kidney half. Kidney half. Like they just went pretty. It's so much fun to be a kidney. They got to process blood and urine. That actually is not fun. The adrenal glands can release a lot of different substances and hormones, but two important ones are adrenaline and cortisol. Increase your sympathetic response. Do the things that need to happen. Heart rate will keep sugar in your bloodstream, make your mind go alert. Parasympathetic. A lot of things. That's getting eventually it's all injection. It's all think of the response. Primary and secondary ovaries, more in-depth views of reproductive system. For now, what the hormones that they produce. We'll start with the ovaries. In this diagram, we have the uterus here, here are the fallopian tubes, and then here are the ovaries. The ovaries are going to regulate the menstrual cycle. And they'll do that using their hormones, estrogen, progesterone. Again, I'll cover that more in depth. All secondary female sex characteristics. They call the outward features, whatever occur in puberty. That's what we mean by secondary sexual characteristics. Now, the ovaries don't just produce estrogen and progesterone; they do produce testosterone as well, just in lower amounts. As ovaries, where they have the testes, they're going to be producing both estrogen and testosterone at different amounts depending on which. The ovaries also release eggs during the menstrual cycle. Next, in the male reproductive system are the testes. The testes have two main functions: that is the production of testosterone. Testosterone will help with sperm production. Secondary male characteristics. Think of all the outward things that happen during puberty, and that's what we're talking about with secondary sexual characteristics. Primary organs of the endocrine system. Now let's take a look at the torso model and see where those organs are located three-dimensionally. There you're up. All right, so we'll start off with the brain. In the brain, we have the pituitary gland, which hangs off the front or the anterior side of the brain. That's the controller gland that controls all the other. Melatonin and regulator sleep cycle. Just superior to the pituitary gland is the hypothalamus, which controls the pituitary. Up here in the neck is the thyroid gland. The thyroid gland looks sort of like a bow tie around the trachea or the windpipe, and it regulates the body's metabolism. Also, if you ever see a thyroid gland bow tie, that should totally be a thing. I would totally wear it for all these videos. Please let me know if you find one. Now, the parathyroid glands are going to be posterior or behind the thyroid gland here. Those are those four dots. The parathyroid glands will regulate the calcium levels in your bloodstream. Now, Terry doesn't have a thymus gland, but if Terry did, it would be right here. It would be superior to the heart and medial to the lungs. And that thymus gland is in charge of developing your immune system during adolescence. Up next, we have the pancreas. Yes. I the liver and the stomach and the intestines here. So let's take a look. So here's the pancreas. It's connected to the small intestine as well as here. And the pancreas is insulin. The adrenal glands release adrenaline. Regulate your body's response to stress. You have to go breathe. Female reproductive here. Right here. And right here. Ovaries are in charge of eggs, regulating the menstrual cycle, producing estrogen. So it's all the secondary female cell characteristics. Cells make testosterone develop sperm cells will develop all the male secondary characteristics. Now, before we go, if you like pause the video, you can name all of the endocrine organs as well as what's each endocrine. We have the pituitary gland, which controls all the other glands. It also makes oxytocin, the love hormone, and growth hormone. And of course, the hypothalamus controls the pituitary. We have the pineal gland, which makes melatonin. We have the thyroid gland, which regulates your metabolism. The parathyroid glands, which regulate the calcium level in the blood. We have the thymus gland, which develops your immune system during adolescence. There's the pancreas, which is going to release insulin and glucagon to regulate your blood sugar levels. And just superior to the kidney these are the adrenal glands, which produce adrenaline and cortisol to regulate your body's response to stress. Finally, we have the ovaries and the female reproductive system, which are going to release egg cells, regulate the menstrual cycle, and make estrogen, which is going to develop the female secondary sexual characteristics. Finally, the male reproductive system are the testes, which will produce sperm cells, as well as testosterone, which will develop the male secondary sexual characteristics. All right, I guess we've reached the end of the video. Yeah, that was a little strange. Well, you probably learned something about this. It's regulating the amount of sugar. Insulin being the becoming the regulate that sugar. And the is involved in species by being sides of sugar, whenever it's not in diabetes mellitus, diabetes, and autoimmune disease, relies on a system attacking some of those pancreas helps the body have developed to resist things. Therefore, keep bringing blood sugar levels back down. Need to be. In this video, we're covering how the pancreas regulates those blood sugar levels. Diabetes. See how both of those prevent the pain. And the pancreas is going to work as the sensor detector. It's going to detect how much sugar you have in the bloodstream. It's going to compare them to something. In the case of the blood sugar, it's going to say, hey, this is too much sugar. We need to remove some sugar. It's it's going to start taking sugar from the bloodstream and storing it in its stream. Sugar before it gets glucose in the liver. It doesn't just store glucose. It has cells that respond to together and build a long chain of molecules that we call glycogen. And we use that glycogen as a way to store the glucose molecules. I think the best metaphor for this is Legos. An individual glucose is represented by an individual Lego brick. Glycogen, however, that's what you get if you take a bunch of those Lego bricks and you start stacking them together. So whenever sugars in our bloodstream, it looks like this, just a pile of Lego bricks that are floating around. What we call glycogen. So individual glucose molecules and the large branching glycogen molecules. So we'll be taking in the glucose and they'll be adding them to the glycogen molecules that are already in the liver. It's going to cause our blood sugar levels to decrease back down to the range. So that was the case of high blood sugar. The pancreas detects the high blood sugar, compares it to the subway, says it's too high, releases insulin, and then insulin tells the liver to bring in sugar from the bloodstream, which lowers the blood sugar levels back down. Blood sugar is a very small process, just kind of the opposite. Again, the pancreas is going to detect the blood sugar level. It's going to compare the blood sugar level to the subway. It's the integrator.
In about 10 kilometers, take exit 78 onto 53 toward County Road 450.
Sugar to get the energy that they need. So the pancreas then places a different insulin stay because at this point glucose has sort of gone. In other words, we don't have enough of it. As glucose has gone, we need to bring glucose back into the bloodstream. Don't get this confused with glycogen. We have three G words: glucose, glycogen, and glucagon. So the sugar molecules in the bloodstream. Glycogen is how we store sugar molecules in the liver. That's the big sugar molecule, right? Glucagon is the pancreas releases to get the blood sugar is too low. So glucagon is going to travel the bloodstream and it's going to make it to the liver. And it's going to tell the liver to take some of those glucose molecules that are releasing them back into the bloodstream. As it adds those glucose molecules back to the bloodstream, blood sugar levels will up to where they need to be. So if your blood sugar is too low, the pancreas will detect it. Compared to the set point, say that this is too low, the pancreas will release glucagon, which is a hormone that will travel to the and tell the liver to start releasing glucose molecules into the bloodstream. That'll bring our glucose levels back up to where they need to be. Now let's take a look at type 1 and type 2 diabetes. Type 1 diabetes is an autoimmune. The autoimmune system is attacking cells that are healthy tissue cells. In type 1 diabetes specifically, the immune system is attacking the beta cells in the pancreas. The beta cells are specialized cells whose job it is to create insulin. So all of our insulin secreting cells in the pancreas start getting destroyed by our immune system. A person with type 1 diabetes then won't be able to produce insulin on their own. So how does this affect the process of blood sugar regulation? If a person with type 1 diabetes eats a meal, especially a high sugar or high carb meal, their blood sugar is going to spike up. The pancreas will detect the blood sugar level and compare it to the blood sugar is too high, and it won't be able to make any insulin. So now the blood sugar will stay high for longer than they should. But the main problem is the body is not.
Hello? Good, how are you?
Yes, you can start earlier. Yeah.
Oh, earlier, what day is the earliest?
Any day, you let me know the earliest you can start.
Oh, no, I mean we have to fly there, right? It takes 4 hours flight.
Yes. Yeah, the date. Can you start not the time? Can you start maybe at the 10th? Or can you start before 14th?
I can start the 13th.
Okay.
I will try 11 is the earliest.
11th, that's Monday. Okay.
Will be to prescribe type 1 diabetes after they eat the meal. It's got a lot of sugar and carbs in it, and they'll have to take an insulin injection. That artificial insulin won't mimic the natural insulin that the body usually makes and tell the liver to bring sugar from the bloodstream back into the liver. Now, type 2 diabetes is very similar in its effects, but it's very different in what's actually going wrong in the process here. In type 2 diabetes, the pancreas releases insulin just fine. That's not a problem. Instead, insulin that's mainly the liver, but also other cells throughout the body that can store sugar. They've become resistant to the insulin molecule. So the insulin hormone molecule is there and present, but nothing's responding to it. The body's developed a resistance to it. So it won't be a treatment for somebody with type 2 diabetes. Prescribing insulin usually won't get the job done. Some extra insulin could help, but if the body's become resistant to that insulin in the first place, that's not going to be a long-term fix for it. More insulin just means more insulin to the body to ignore. Instead, people with type 2 diabetes are going to be very careful about what they eat. They have to make sure that they don't eat meals that are very high in sugar. If they do, that they will eat a small amount of sugar.
In 2 kilometers, take exit 78 onto 50 road. 50.
Just in case. Later. If you know somebody who's a kid who has diabetes, they most likely have type 1 diabetes. Type 1 diabetes is often diagnosed during childhood. But if you know somebody who developed diabetes later in life, it's probably type 2 diabetes. Both of these result in the body not being able to self-regulate its blood sugar levels, leading to the need for other interventions, such as taking insulin or changing up what we eat. Let's recap all of this real quick. If blood sugar is too high, the pancreas will detect the blood sugar. Compared to the cell.
Use the right lane to take exit 78 onto 50 road toward County Road 450.
Rồi bác ơi, con bận rồi. Có chỉ được là lái xe.
Insulin's going to travel to the liver and tell the liver to take sugar molecules from
Take the exit, then keep right onto County Road 450 South.
glucose molecules and attach them to other glucose molecules to make a larger molecule.
Use the right lane to keep right onto County Road 450 South.
This will bring blood sugar levels back down to where they need to be. Now, if blood sugar gets too low between meals, for example, the pancreas will detect the blood sugar level and it will compare it to the set.
Keep right, then take the first right onto South Service Road.
Pancreas will then release the hormone glucagon, and that glucagon will travel to the liver and tell
At the light, turn right onto South Service Road.
start peeling off the glucoses and putting those back into the bloodstream to raise the blood sugar levels back up to where they need to be. There are two types of diabetes that can interfere with this whole process. In type 1 diabetes, it's an autoimmune disorder where the beta cells in the pancreas have been destroyed by the body's immune system. This means that the pancreas cannot make insulin. The main treatment for this would be for the patient to take artificial insulin, likely through an injection. In type 2 diabetes, however, the pancreas makes insulin just fine. The problem, though, is that tissue throughout the body, such as in the liver and other cells that store sugar, have stopped responding to insulin. They've become insulin resistant. And now, even if there's insulin present, they're not going to take sugar out of the bloodstream, so that blood sugar remains high. Let's talk about sugar is making me hungry. Luckily, my school is really awesome, and I have this leftover piece of cobbler that I'm going to eat in front of you for the next 15 seconds of this video. It's so good. Got some of this. All right,
Go this way. Then at the next one, turn left.
All right, do you want to read Hormones Go to School? Hormones Go to School. It's hot. Hormones help us grow.
Stay in the right lane.
They travel through our blood on the hormones have special
At the light, turn left onto Vince Vaz Way. Then turn right into the parking lot.
here. Let's they're like students. And you can travel behind to make improvements. Cells are like schools where moms go to work and get out of their job. Yeah, can you point to the school? Yeah, it's a school. Hormones go to school in different parts of the body. There's a place for everybody. Look, where's the brain? Do you see a brain? Yeah, there's the brain. Okay. Some hormones stay close while others travel far. It just depends on what type of hormone they are.
In 250 meters, turn right into the parking lot.
Yeah, hold on. Let's read this one. Each hormone has a certain school it needs to go to. It may stay home. Right through. So, this hormone goes to school and home. In the body, she has no need to roam. That's an autocrine hormone. Yeah, that's autocrine.
Turn right into the parking lot, then arrive at your next stop.
To go. There's school. It's a paracrine hormone. This hormone travels far to get its job done, passing by the wrong schools until it reaches the right one. Do you find the green school? Where's the green school? No, it's up here. Green school. Just like students, hormones travel in many different to get to the place most of our.
Continuing route to Raleigh Lane.
Do you like the book?
In 500 meters, turn right.
Aren't you content video? insurance coverage designed to have you for you. Let nobody service folks take care of the shopping. Find the best coverage for you. It's quick and
At the next light, turn right. At the light, turn right onto South Service Road.
Thank you for calling CAA. For a one, some of them add an associate to your existing account or upgrade your existing membership. Press 2. Your member. Your call will be recorded and may be monitored for accuracy and service quality. One moment, please, while I try to locate your account information. I was able to retrieve your account information, and I will now connect you to a TAA agent. How can I help you?
Hello?
How can I help you?
I used to be member, but I'm not sure if it's still active. I want to enroll again.
Can I get your name?
Lien.
And what is the email that would be on the account?
LIENLE Canada@gmail.com.
Did you have a different one?
LIENLE1214@gmail.com.
No.
Yahoo?
Yeah.
LIENLE1214@yahoo.ca.
Yeah. Phone number you're calling from, I have.
Yes. Yes.
Okay.
Okay, so 48 hours, okay. I'm okay for 48 hours. How much is it for now? 119. The plus the coverage of the plus. Can you okay. See. So the plus 200 kilometers. So how we how can we go ahead and process? Okay, it's a visa debit. Automated. Okay. Yes, my name. Can you change the email address for us?
Yeah, I'll take that for you in a minute.
Yes. Off now. January 2026. The name. Let me try again before I speak to another call. Sometimes the call doesn't work. Think 2028, not 26. 2028. LIENLE Canada@gmail.com. Oh, even your address. Yeah, it's very long time. What's the address on the file? M. Yeah. L4H. Yeah, it's fine. 2T7. Daisy View, and number 102. Yeah. Uh, email. Mm. Uh, this is not very long. It's 2 years old. Everything's very relaxed. Thank you. It's fine. Um, thanks. I think they had me. I had to. Tell them. That's it. Family, my friend, guidance, like, it's, yeah, they talk to me. So. Yeah, I mean, surprisingly, last year, it's like, yeah.
Its balance is the precise maintenance of the hydrogen ion concentration in blood and tissue fluids, so the body will function properly.
Yeah. Sắp chết rồi.
Have benign prostatic hyperplasia, or BPH, your prostate gland is enlarged. The prostate is a walnut-sized gland in men. Just beneath your bladder, your prostate gland surrounds your urethra, the tube through which urine and semen exit your body. Your seminal vesicles and prostate make fluid that combines with sperm cells to create semen. During normal urination, urine flows from your bladder through the part of your urethra inside your prostate, then through the rest of your urethra to leave your body. For unknown reasons, your prostate gland may enlarge as you get older. You have benign prostatic hyperplasia. Your prostate may grow large enough to compress the part of your urethra that runs through it. As a result, your enlarged prostate may slow the flow of urine out of your body when you urinate. Left untreated, your prostate can get larger. This may keep you from fully emptying your bladder. See your doctor right away if you are unable to urinate. Your risk for benign prostatic hyperplasia is higher if you are age 40 or older, have a family history of BPH, have other health problems such as obesity, diseases of the heart and blood vessels, or type 2 diabetes, don't exercise, or have erectile dysfunction. Symptoms of benign prostatic hyperplasia include frequent urination or urge to urinate, especially at night, a weak, interrupted urine stream, and straining to urinate. Over time, untreated benign prostatic hyperplasia may cause the following complications: inability to urinate, damage to your bladder and kidneys, urinary tract infections, bladder stones, and blood in your urine. If you have benign prostatic hyperplasia with mild or no symptoms, you recommend watchful waiting, which includes getting your prostate checked every year to make sure your symptoms of health are not getting worse. If you have moderate symptoms that bother you, your doctor may recommend medications such as alpha blockers or those that treat erectile dysfunction called PDE5 inhibitors. These medications relax muscle tissue in your bladder, urethra, and prostate. This can help improve your urine flow. 5-alpha reductase inhibitors may also be prescribed. This medication helps to improve urine flow over several months by reducing the size of your prostate. You may receive a combination of these drugs. If medication isn't relieving your symptoms, Your doctor may recommend a surgical procedure called transurethral resection of the prostate. This procedure, your surgeon will insert an instrument called a receptoscope through the urethra to reach your prostate. And a wire loop at the end of the receptoscope will be used to shave off tissue, which will widen your urethra. Other invasive variations of this type of procedure use lasers, microwaves, radio waves, or electrical energy from tools inserted through the receptoscope to remove some or all of your prostate gland. If your prostate is very large, your doctor may recommend an open prostatectomy procedure. In open prostatectomy, your surgeon will make an incision in your lower abdomen. After exposing your prostate, your surgeon will make an incision in its outer capsule. Next, the tissue inside your prostate will be removed, and the capsule incision will be closed with sutures. Finally, your skin incision will be closed with sutures or staples. You can't prevent benign prostatic hyperplasia. Lifestyle changes can make your symptoms less severe. Medication that can make it harder for you to urinate, such as antihistamines and decongestants. Stop drinking fluids for a few hours before bedtime. Stop drinking alcohol, fluids that contain caffeine. Urinate again. Your healthcare practitioner. Diagnose conditions of your urinary system or urinary tract produces urine and excretes it from the body. It includes the kidneys, ureters, bladder, and urethra. In men, the prostate gland wraps around the urethra at the base of the bladder. As blood circulates, it passes through the kidneys. Wastes and extra fluid are removed to create urine. The urine then moves down the ureters to be stored in the bladder and expandable balloon-shaped muscle. During urination, urine leaves the bladder through the urethra and is expelled from the body. By allowing your doctor to view the interior of the urethra, bladder, and the openings of the ureters, a cystoscopy may reveal the following conditions: an unusual growth such as a polyp, cyst, or tumor, a stone in or near the bladder, chronic inflammation or infection, a stricture or narrowing of the urethra, enlargement of the prostate gland, or ulcers in the bladder wall. Before your procedure, an IV line may be inserted into your vein to provide medication. Your doctor will begin by applying a local anesthetic to numb the area. Once the area is numb, he or she will gently insert the tip of a cystoscope into the urethra and slowly advance it up into the bladder. The end of the cystoscope contains a light source and lenses which project images through an eyepiece and onto a video screen. By introducing a clear, sterile solution, your doctor will expand the bladder. He or she will carefully examine the lining of the bladder and urethra by looking through the eyepiece on the cystoscope, as well as by viewing images projected onto the video screen. When your doctor is finished, the scope will be removed. Your doctor can tell you what was seen immediately after the test. If a biopsy was taken, results are usually available in a few days. This procedure usually lasts about 2 to 10 minutes. You would usually be able to go home soon after your cystoscopy. Your doctor will likely prescribe antibiotics to prevent an infection and may offer you medications to treat any lingering discomfort.
You or someone you care about may have been diagnosed with bladder cancer. This video will help you understand more about bladder cancer and how it affects your body. Your bladder is a hollow, muscular organ. It stores urine made by your kidneys. From the kidneys, urine travels through tubes called ureters to reach your bladder. From the bladder, urine passes out of your body through another tube called the urethra. The tissue lining the inside of your bladder is called urothelium or transitional epithelium. The most common type of bladder cancer, called urothelial carcinoma or transitional cell carcinoma, begins in this layer. Here, normal cells change into abnormal cells called cancer cells. Over time, these cells can grow out of control and form a cluster called a tumor. There are two types of urothelial or transitional cell carcinomas based on how they grow. A papillary carcinoma grows in toward the hollow center of the bladder, and a flat carcinoma does not grow in toward the center. Flat tumors are much less common, but they are more likely to spread deeper into the bladder wall. Bladder cancer may have the following symptoms: blood in your urine, feeling an urgent need to urinate, having to urinate more often, pain while urinating, straining to urinate, and lower back pain. It's important to know that other health problems may cause these symptoms as well. Cancer staging is the process where your doctor figures out if your cancer has spread, and if so, how far. Stage 0 refers to either a papillary carcinoma or flat carcinoma inside you that is only on the surface of the inner lining of your bladder. This means it hasn't spread into your bladder wall. In stage 1, the tumor has grown deeper into the lining, but not into the muscle layer. In stage 2, the tumor has invaded into the muscle layer. In stage 3, the tumor has grown through the muscle layer of your bladder wall and may have spread to nearby organs and lymph nodes. Finally, in stage 4, the tumor has spread to any of the following: the wall of your pelvis or abdomen, or to at least one set of distant lymph nodes or a distant organ such as your liver or lungs. A number may raise your risk of bladder cancer. The most important risk factor is smoking. Other risk factors include having a personal or family history of bladder cancer, exposure to certain chemicals in the workplace, past cancer treatments such as radiation or anti-cancer drugs, and drinking water that contains high levels of arsenic. As you deal with a diagnosis of bladder cancer, continue to talk to your doctor and your cancer care team. You or someone you care about may have been recently diagnosed with bladder cancer. This video will help you understand some of the available treatment options. The most common type of bladder cancer, called urothelial carcinoma. In about 10 kilometers, keep right toward Fort Erie, where cancer cells form in the tissue lining the inside of the bladder. Treatments for bladder cancer may include one or more of the following: surgery, radiation therapy, chemotherapy, and immunotherapy. There are two main types of surgery for bladder cancer. The first type is called transurethral resection of bladder tumor, TURBT, with fulguration for early stage cancer. During this procedure, a lighted tube called a cystoscope will be inserted into your bladder. Then, the tumor will be removed with a wire loop. Remaining tumor tissue may be burned away in a process called fulguration. type of surgery called cystectomy is for cancer that has spread into the bladder wall. During a partial cystectomy, the part of your bladder wall containing a small tumor will be removed. After this type of surgery, your remaining bladder may not be able to hold as much urine. You may need to urinate more often. In a radical cystectomy, all of your bladder will be removed if the tumor is large or is in more than one part of the bladder. Nearby tissues such as lymph nodes will also be removed. In men, the prostate and seminal vesicles will be removed. And in women, the uterus, ovaries, fallopian tubes, and part of the vagina will often be removed. If your bladder is removed, a piece of your intestine can be used as a passageway for urine to drain out of your body. It will drain through an opening in your abdomen and into a small bag, or the intestine can be shaped into a small pouch to store the urine before it passes through the opening in your abdomen. In this case, you will put a small tube called a catheter into the opening to empty urine from the pouch. Or if your urethra was preserved, a new bladder can be built from a piece of intestine, so urine can pass out of your body in the usual way. Another treatment option is radiation therapy. It uses radiation to kill the cancer cells or keep them from growing. External beam radiation uses a machine outside the body that aims radiation at the cancer. Internal radiation therapy uses a radioactive source that gives off radiation. The radioactive source is put inside the body, into or near the cancer. Chemotherapy uses certain drugs to kill cancer cells or stop their growth. These drugs may be administered intravenously to treat cancer cells throughout the body, or via a catheter to treat cancer cells inside the bladder. The way the chemotherapy is administered will depend on how advanced the bladder cancer is. Immunotherapy helps your immune system fight cancer. Cancer can sometimes hide from the immune cells that attack them. For example, both cancer and immune cells may have proteins called checkpoint proteins. If these proteins attach, the immune cell won't attack the cancer cell. Some immunotherapy drugs for bladder cancer block the checkpoint proteins from attaching to each other. As a result, the immune cell can attack and destroy the cancer cell. Another example of immunotherapy is called BCG. It's made of a type of bacteria in a solution. BCG is put inside your bladder, where it sets off a response that kills cancer cells. If you have questions about bladder cancer or any medications you have been prescribed, talk to your doctor. It is important to take your medications as directed and report any side effects you may have.
This animation is brought to you by the Smart Image Base, a subscription website where you can download thousands of medical images and videos to use in
2 kilometers. Keep right toward Fort Erie.
training and for more information. Click on the link in the description.
Your urinary tract includes the kidneys, ureters, bladder, and urethra. Your kidneys make urine, which flows through the ureters to your bladder. Your bladder expands to store urine until you're ready to urinate. Muscles called sphincters contract to hold urine in your bladder. When you urinate, the sphincters use the right 2 leads to keep right toward Fort Erie, pass out of your body through your urethra. Strong pelvic floor muscles support your bladder and other organs so they can work properly. Stress urinary incontinence keep right leaks by accident when movement puts sudden pressure on your bladder. It can hit for about 32 kilometers. Continue straight or exercise. Urine can leak if your sphincters or pelvic floor muscles have become weak. Things that can weaken these muscles include childbirth, obesity, aging, and pelvic surgery. To find out more about stress urinary incontinence, talk to your healthcare provider. You or someone you care about may have been diagnosed with bladder cancer. This video will help you understand how to manage it. The most common type of bladder cancer, called urothelial carcinoma or transitional cell carcinoma, is a disease where cancer cells form in the tissue lining the inside of your bladder. For some people with bladder cancer, treatment may remove or destroy the cancer. Receive a follow-up care has a high risk of coming back, so it's important to go to all of your follow-up appointments. Your doctor will want to make sure cancer has not returned and check for health problems resulting from treatment. If your bladder wasn't removed, check for cancer. During a cystoscopy, instrument will be inserted in cancer. Talk to your oncologist about any medications you are taking and continue to take them as prescribed by your doctor unless instructed otherwise. Take note of any side effects and tell your doctor. If you had bladder surgery or other treatments, follow any instructions you were given. You may also need to make some of the following healthy lifestyle changes. If you smoke, it's important to quit smoking. This lowers the risk for bladder cancer returning or getting other types of cancer. Limit how much alcohol you drink. It may reduce your risk of cancer returning. Eat a healthy diet with more fruits, vegetables, and whole grains. This will help you stay strong and feel better. Become physically active. Activities like walking, riding a bicycle, or swimming can help you feel better and less tired. Talk to your doctor before starting an exercise routine. Cancer can be overwhelming. You may have worries about things like your condition and how it affects your family, treatments and hospital stays, medical bills, and your job. Fortunately, there are ways to cope with this. Remember that your doctor and healthcare team are there to answer any questions you have. The following sources of support can help you cope with your concerns: social workers, faith leaders, counselors, and support groups. Talk to your doctor if you have any questions about your treatment plan, medications, or lifestyle changes to help you manage bladder cancer.
This animation is brought to you by the Nucleus Medical Art Library, or NMAL, where you can download this animation and thousands of medical images and videos created by Nucleus Medical Media. To apply for a free 30-day trial, click on the link in the description.
If you have stress urinary incontinence, your doctor may advise you to have a transobturator tape, or TOT, procedure. Stress urinary incontinence means your bladder leaks urine during physical activity. To start the procedure, the surgeon will make 2 small incisions in your groin. Another small incision will be made in your vagina. A needle will be passed through this incision into your body and out of one of the incisions in your groin. A mesh tape attached to the needle will be pulled along this path. Then, a needle attached to the other end of the tape will repeat this procedure on the other side. Once the tape is in place, your surgeon will adjust it behind your urethra to provide support. The ends of the tape will be cut just beneath your skin. At the end of the procedure, the vaginal incision will be closed with sutures. and the groin incisions may be closed with skin procedures. After the procedure, the tape will and prevent urine leakage. Over time, scar tissue forms around the tape to hold the tape in place. To find out more about a transobturator tape procedure, talk to your healthcare provider.
This animation was brought to you by the Smart Image Base, a subscription website where you can download thousands of medical images and videos created by Nucleus Medical Media. To apply for a free 30-day trial, click on the link in the description.
If you have stress urinary incontinence, your doctor may advise you to have attention for your vaginal tape or TBT procedure. Stress urinary incontinence means your bladder leaks urine during physical activity. To start the procedure, the surgeon will make 2 small incisions in your abdomen, just above your pubic bone. Another small incision will be made in your vagina. A needle will be passed through this incision into your body and out of one of the incisions in your abdomen. A mesh tape attached to the needle will be pulled along this path. Then, a needle attached to the other end of the tape will repeat this procedure on the other side. Once the tape is in place, your surgeon will adjust it around your urethra to provide support. The ends of the tape will be cut just beneath your skin. At the end of the procedure, the vaginal incision will be closed with sutures, and the pubic incisions may be closed with surgical procedures. After the procedure, the tape will support your urethra and prevent urine leakage. Over time, scar tissue forms around the tape to hold it in place. To find out more about a tension-free vaginal tape procedure, talk to your healthcare provider.
This animation was brought to you by the Smart Image Base, a subscription website where you can download thousands of medical images and videos created by Nucleus Medical Media. To apply for a free 30-day trial, click on the link in the description.
Please watch this entire video before removing your catheter. This video will teach you how to empty your Foley bag and remove your Foley catheter. A Foley catheter is a thin rubber tube that runs from your bladder to a Foley bag that collects urine. A balloon filled with water holds the catheter in place. A syringe removes water from the balloon through the balloon port. Removing your Foley catheter involves emptying your Foley bag, deflating the balloon, and removing your catheter. You will need disposable gloves, a syringe for removing the water from the balloon, and a clean cloth or paper towels to clean up spills. Be sure to keep the Foley bag lower than your hips to allow the urine to drain out of your bladder and into the bag. Step 1. Wash your hands with soap and water and then dry them. Step 2. Hold the bottom of the Foley bag over a toilet. Step 3. Open the drain valve. Urine will begin draining from the bag. Empty the urine from the bag. Step 4. Close the valve. Now you will begin removing the catheter. Step 5. Wash your hands with soap and water again, and then dry them. Step 6. Put on disposable gloves. Step 7. Unclip the catheter from your leg. Step 8. Hold the balloon or tubing in one hand. Firmly push the end of the syringe into the balloon port and twist until you make a tight connection. Water from the balloon begins filling the syringe. Step 9. When the balloon is empty, relax, take a deep breath, and gently pull on the catheter to remove it. Do not pull hard. If gentle pulling does not remove the catheter, contact your healthcare provider. After you remove the catheter, drink plenty of water to create the urge to urinate and ease burning when passing urine. Contact your surgeon if you have any questions about your Foley catheter. Your temperature is 101 degrees Fahrenheit or higher. Your bladder feels full, but you see no urine draining into the Foley in about 10 kilometers. Turn right. Your catheter with gentle pulling. Your urine is cloudy, has a foul odor, or you see a lot of blood in your urine. It is normal to see a small amount of blood in your urine after removing a Foley catheter. Also contact your surgeon if you cannot urinate within 8 hours after removing the Foley catheter. You feel burning or pain when urinating that lasts longer than 24 hours. Your stomach feels bloated or painful. You feel the need to urinate more often than normal. Or your bladder doesn't feel empty after urinating.
This animation is brought to you by the Smart Image Base, a subscription website where you can download thousands of medical images and videos to use in lectures, courses, presentations, professional training, and more. For more information, click on the link in the description.
Please watch this entire video before removing your catheter. This video will teach you how to empty your Foley bag and remove your Foley catheter. A Foley catheter is a thin rubber tooth that runs from your bladder to a Foley bag that collects urine. A balloon filled with water holds the catheter in place. A syringe removes water from the balloon through the balloon port. Removing your Foley catheter involves emptying your Foley bag, deflating the balloon, and removing your catheter. You will need disposable gloves, a syringe for removing the water from the balloon, and a clean cloth or paper towels to clean up spills. Be sure to keep the Foley bag lower than your hips to allow the urine to drain out of your bladder and into the bag. Step 1. Wash your hands with soap and water and then dry them. Step 2. Hold the bottom of the Foley bag over a toilet. Step 3. Open the drain valve. Urine will begin draining from the bag. Empty the urine from the bag. Step 4. Close the valve. Now you will begin removing the catheter. Step 5. Wash your hands with soap and water again and then dry them. Step 6. Put on disposable gloves. Step 7. Unclip the catheter from your leg. Step 8. Hold the balloon or tubing in one hand. Firmly push the end of the syringe into the balloon port.
Rồi à. Nó có tiền. Nào mà nó thấy hết sẽ ra được tối nay gọi đi, nói là tối nay mình đi.
Until you make a tight connection, water from the balloon begins filling the syringe. Step 9. When the balloon is empty, relax, take a deep breath, and gently pull on the catheter to remove it. Do not pull hard. If gentle pulling does not remove the catheter, contact your healthcare provider. After you remove the catheter, drink plenty of water to create the urge to urinate and ease burning when passing urine. Contact the surgeon if you have any questions about your Foley catheter. Your temperature is 101 degrees Fahrenheit or higher. Your bladder feels full, but you see no into the Foley bag. You can move your catheter with gentle pulling. Your urine is cloudy, has a foul odor, or you see a lot of blood. It is normal to see a in 500 years. The Foley catheter. Burning pain when urinating that lasts longer than 24 hours.